Okay, take two. Hi. Welcome to another edition of Between Two Molars. I'm Trevor Maurer. Other Molar?
Hey, Trevor. It's Josh. Good to see you.
I don't know what's going on, but the last time we started this meeting, it thought we were speaking Spanish. Hola. I don't know
¿Cómo
anything about that.
estás? Hey. All right, great.
Much
No,
better
no
than me.
Spanish today.
We also not only have no Spanish today, we have no between. This is just welcome to another edition of Two Molars.
It's great. We got stuff to talk about though, Trevor.
We do both in our cars. Really excited about the business. So Trevor Maurer, CEO of Almost 360, Dr. Everts, Chief Clinical Officer, and we're both really excited about what's going on. So I thought we'd give an update on what's going on.
It's great.
Dr. Everts, what are you most excited about? Give me three things.
I am super excited about how our doctors are collaborating and learning and trying new things. We've got a lot of great examples out there. We've got Dr. Cornejo, who took the initiative and has all the doctors on a secure platform to talk about clinical cases.
Love
Lots
that.
of great clinical cases going back and forth. We've
My
got
favorite part about that platform is he kicked me off of it in the
doctors
nicest way
only.
possible. That was great. Doctors only. I'm like, you know what? That makes so much sense. I love it.
Yeah, it's been really fun. Really interesting to see the different stuff that everybody's talking about on there, and just kind of feels very much like we're back in residency, putting cases.
Oh, that's cool.
We also got Connor Sherwood. He's doing he just did his first all-on-4 with photogrammetry, actually. So love seeing the
Nice.
technology being used in the clinics. He's not the only young buck out there trying new things. We've got even some of our more seasoned athletes. We've got Donald Phillips, who is eager and excited to learn a little more about same-day surgery and the way that we run clinic over in Carrollton, Georgia. He's actually going to come join me and work in clinic for a little while and kind of expand his
Donald
practice
is
into a new
younger than
model.
I am, so if he's a seasoned athlete, what am I? Am I up in the
You're
spotting
you're
booth?
well seasoned. You're a well
Seasoned.
seasoned athlete.
Okay, there you go.
That's why you're in charge, man. We need the experience.
It's based on age. How old are you? You're CEO. Perfect. Thanks for coming.
That's great.
What else are you excited about? Those are two cool things.
Well, we've got tons of traction from our business development. The messaging is hitting home with these young and well-established doctors just looking for a portfolio company like ours that is willing to make some changes that maybe they couldn't have made on their own, right? I think that shows a lot of value in growth and structure and systems. They're really excited about the operating system. They're really excited about integrating across multiple practices, and I think that's really good to see. It makes it really nice because they are really encouraged partners, and the integration and the operations team has a kind of a fertile ground to work in when they already know what's coming. So it's been great to see that happen, and we've got a lot closing in the next few months. Yeah.
So the non-doctor view on that. So having met with a lot of surgeons in the Southeast about this organization over the last 3.5 years, many, and even us, I think early on in the messaging, we weren't really sure what we're going to change in the practice because we hadn't done it yet, right? Like Josh, remember we joined practices, and Bob Clark, the KCOM's managing partner and incoming president of Amos, when we partnered with both your practices early, we talked about what are we going to change, and we're like, we don't know, but we're really good at this. Our backer is very focused on organic growth of the businesses and building good businesses, but we're not sure exactly how we're going to do it, right? And we kind of stumbled and figured it out, as all new businesses do, right? As you're setting your course, you have your strategic direction, and then you get in the market and you have to shift direction a little bit to make sure you're going to deliver on what you say you're going to deliver. And so as we have these conversations, surgeons would say to me, well, I talked to ABC company and they said, don't change a thing. Here's your bag of money and life's good. Now I hear that, and it's so fundamental that why would you invest in a business that doesn't have a plan that says we're going to improve the business?
Right.
Like, yeah, I'm going to take away your admin work or marketing or HR, but is that improving the business? That's just having someone else do it, right? So it's funny because we'll talk to these surgeons, or obviously the M&A team will talk to them, and they say, well, we're not actually interested if you don't want to improve your business. And it's this great bifurcation of, targets. Like, do you want to grow or not? Like, do you want to be part of something that's growing, or do you want to keep doing what you're doing? Because if you want to keep doing what you're doing, let me give you the phone number to those groups. They're nice people, they're good groups, they're
Sure.
probably fine. But that's not what we're trying to do, is make system-wide changes. Of course, it's not one size fits all, right? One might be implant growth, one might be scheduling optimization, one might be treatment plan optimization. But to have these levers that we really consciously lean in on with the group, and we're intentional about the changes we're making at a practice, is so exciting to see it work.
Yeah. Yeah, it really is.
I'm
And I,
so proud of the team.
yeah, me too. And I like that we took our time to figure out what our personality was in all of this. I think OMS 360 has done a great job of just being patient, understanding what does the market need, what does actually lead to patient satisfaction in the patient journey. What do the patients really want? I think
Yeah.
that's not a question that a lot of these organizations are asking. When you put it through the lens of the patient experience and what happening from a patient perspective, you don't have to. I mean, you get to marketing is great, right? But the best marketing is word of mouth marketing, and the best way we
Yeah.
can promote our practices is for all of these patients to have great experiences. So, and I really think that's what we looked at when we found this operating system. And I'm
Yeah.
really proud of that. I'm really proud of what the team is doing, and that most definitely is showing through with the business development team.
So this is one of the first Between Two Molars that's going to go public. So what I would say to the OMS team, super proud of all of you for developing this system, leaning in, fine tuning, and giving your patients better experiences, ultimately your referrals better experiences, which makes everybody in the practice happier. Surgeon team. For those of you that don't know what we're talking about, that are not in OMS 360 and you're curious, I'm sure there's a link. Click the link. We'll tell you more. But love to talk to you about what's different about what we're doing, and if it's interesting, we'll see if it makes sense for a partnership.
Great. I want to join. Trevor, can I join?
You're in.
Oh, I'm already in.
You're in early. Awesome. Well, hey, drive safe.
You too.
Good to see you. I'm
Awesome.
stationary. Yeah,
Okay.
I must be driving my Waymo or something.
You're doing it like in the movies. It's great.
Absolutely. Have a great day.
Awesome.
Good weekend.
Enjoy your
Bye,
day.
everybody.
Bye.